Well, in this week's Cardiology Countdown, I want to highlight some of the journal scans we have as part of our clinical communities, highlighting 2 in the biomarker clinical community and 1 for the AFib clinical community. So to begin with, we have a very interesting analysis of galectin-3, a newer biomarker for heart failure, measured both at baseline and at either 3 and 6 months, where this study looked at the change in galectin-3 over those 3 to 6 months versus subsequent outcomes. And this was done in 2 trials, in the Corona trial of statin and of the Coach trial, both heart failure trials. And interestingly, using a cut point of a rise in galectin-3 of greater than 15%, they found about a 50% higher risk of death, even when controlling for BNP, LV ejection fraction, etc. And so an interesting new marker that's a marker of fibrosis that may give interesting pathophysiologic insight into higher risk in heart failure. Next, we have another biomarker journal scan. This is from a paper in Circ Heart Failure that looks at the use of troponin in patients admitted with acute heart failure. This was a study of more than 13,000 acute heart failure patients at emergency department in Ontario, where they found that about 13% of patients were troponin positive on admission. And those patients had a 9-fold higher risk of death compared to troponin-negative patients. They found, not surprisingly, there was a higher rate of coronary angiography, about 20% versus 10%, and subsequent revasc. And when trying to look at the role of revascularization, those who underwent revascularization appeared to have lower mortality, suggesting benefit, but it's an observational study. And so I think a very interesting look at the use of troponin in risk stratifying acute heart failure patients. And this week's number 1 pick is an analysis of the Averroes trial of atrial fibrillation, comparing the new anticoagulant apixaban, recently FDA approved, as compared with aspirin in patients who were deemed unsuitable or unable to take oral anticoagulation with warfarin. This study, as you know, as a whole showed about a 50% reduction in stroke or systemic embolism. This analysis stratified patients by the CHADS2 risk score and by the CHADS-VASc risk score. And interestingly, they found a very clear benefit even in CHADS 0 or 1 patients, with the hazard ratio favoring apixaban of just 0.38, so a more than 60% reduction in ischemic stroke in patients with CHADS 0 or 1 using apixaban versus aspirin. And so I think a very useful analysis to say that, as the European guidelines have noted, that even the low CHADS risk score patients benefit from anticoagulation, in this case apixaban. And so for this week's Cardiology Countdown, I'm Chris Cannon.